Hello. Let me talk to you today about what I call the clinician's illusion. This is the idea that what we see when we're caring for the people that we work with is all there is. I fell for the clinician's illusion in a really big way when I first qualified. That was back in 1995, when most of us believed that conditions like schizophrenia were absolutely irrecoverable from. And I believed that because for the first 5 years of my practice, I worked on psychiatric acute wards where we had people admitted in crisis with some really awful conditions, to be honest. Anything from anxiety and depression to various forms of psychosis, bipolar affective disorder, personality disorder, complications, all sorts of things came in. But the one thing that I noticed is that people who had diagnoses like schizophrenia tended to come back time and time again. So I believed, as I'd been taught as well in nurse training, I believed that people with diagnoses of schizophrenia don't recover, because I never saw anyone recover. But then I wouldn't, would I? Because I worked in a hospital. I worked on acute admissions. People who recover don't come to acute admission wards. So realistically, I was never going to be exposed to people who'd recovered. And that's the clinician's illusion. It's the idea that what we see is all there is, but it's not. What I now know is that even in this country, recovery rate from schizophrenia is around 40%. In some parts of the world, according to the International Study of Schizophrenia, it's as high as 90% recovery from disorders like schizophrenia. So it's always worth bearing in mind that just because you don't see recovery doesn't mean it doesn't happen. And that's extremely important in the light of what I spoke about a little earlier, therapeutic optimism. We have to be able to accept recovery even if we don't personally see it or don't see it very often. Because what we see is not all that there is.